Honourable Speaker, I thank the Honourable Member for the question. Honourable Speaker, we have 4 quarantine facilities in the Western Division, in Nandi, and also 4 in the Central Division in the Greater Suba area. Honourable Speaker, quarantine facilities are places where we bring people from areas that may have a disease, and we put them in quarantine for a period of time that's stipulated according to the incubation period of a particular disease. In this case, COVID-19, for 14 days, and watch them and do testing to see if they actually develop that particular disease. So we must separate quarantine facilities from isolation facilities. So isolation facilities are actually places where we have those that are sick taken to and looked after. And some of them can be in a hospital health facility or can be in a community isolation that are being used. Right? So I think it's important, Honourable Speaker, just to demarcate the difference between quarantine facilities and isolation facilities. The quarantine facilities in Nandi, Honourable Speaker, since the flights and passengers have been reduced remarkably because of the closures that have been imposed, are now predominantly those of our staff and those within the Nandi area that have been put aside because they are possibly primary contacts of cases that have been in those areas. At the moment, we're using Nalangi Tano International Hotel, Nassau Resort, and Sofitel, in which we have 222 Fijians in these facilities. Since the increased number of cases that we've had in the Central Division, predominantly in the Nosori to Suba corridor, Suba to Nosori corridor, a number of hotels have been designated as quarantine facilities after thorough assessments. And the following hotels have been used as quarantine facilities: Grand Pacific Hotel, James Cook Hotel, Holiday Inn Peninsula. At the moment, there's about 151 that are in these hotels. And some of these, those who are in these quarantine facilities are our staff. The Honourable Attorney General had alluded to that earlier, in that we have staff working in bubbles. Honourable Speaker, each quarantine facility is assessed and is manned by a health quarantine officer. And in the initial foray into quarantine facility last year, there was a competitive expression of interest that was put out, and they expressed the interest to be able to be used, and that's how they were then put through the assessment strategies that were in place. The assessment is done, and training for infection control is also provided for the hotel staff and also the facility management. And they're briefed on the protocol and procedures to be able to safely manage this facility together with our support staff and also the discipline forces in the RFMF, who are working with us to ensure the safety and security of the premises and its occupants. All the persons are quarantined and monitored daily for a period of 14 days, and also entry and exit swabs are conducted by a swabbing team. It is also during this period that, importantly, bubbles are created, and they work within these bubbles and also quarantine corridors in terms of those who are coming to check them daily. There's an existing standard operating procedure to safely manage this at all levels. Honourable Speaker, in the facilities I've alluded to earlier, they're within their bubbles and clusters, and rules and regulations, rules and policies are described both to the staff and also to those who are in these quarantine facilities. And security is monitored by both the discipline forces that are there and also the CCTV that is also being watched by our discipline forces. I thank you, Honourable Speaker.